The public health nightmare that is the Ebola virus has returned to the African continent. It started again after 2 patients tested positive for the disease in an isolated market town called Bikoro in the Democratic Republic of Congo, DRC. The deaths of 17 others this year have been linked to the outbreak.Furthermore, Sky News understands that at least 10 others have been infected, including staff members at the hospital in Bikoro. Congo's health minister announced that one of the 10 had died on Thursday.So. So far, this outbreak remains relatively small, and it is not the first time Ebola has surfaced in the DRC. The deadly virus was discovered and identified here in 1976, and this war-weary nation has played host to it on 8 additional occasions. But the country's hard-pressed Ministry of Health, along with specialists from the World Health Organization (WHO) and Medecins Sans Frontier (MSF), will have to act aggressively to check its advance, with officials telling Sky News they are now urgently assessing the situation. And there are several reasons to be seriously concerned. For starters, a WHO official revealed that several cases of Ebola were first documented back in December, meaning that the virus has already had 5 months to spread. Then there is the highly infectious nature of the disease itself. When a person contracts the Ebola, they generally exhibit symptoms like fever, headache, diarrhea, vomiting, including bright red blood, and internal hemorrhaging. It is spread through bodily fluids and extremely contagious, and the Zaire species, first detected on the Ebola River in the DRC, results in death in 60 to 90% of cases. There is no cure for it, although scientists are making progress with treatments using antibodies sourced from horses and mice. Thirdly, health professionals will be mindful of recent experience.The world's worst Ebola outbreak took the lives of 11,000 people in Sierra Leone, Guinea and Liberia in 2014 after the virus spread from a young boy living in a village in rural Guinea. Poorly equipped and understaffed medical workers turned down infected patients, and when the disease spread to the densely populated Liberian capital of Monrovia, a health crisis turned into a catastrophe. In early 2016, the WHO said the outbreak had been contained and eliminated, but 17,000 survivors were left traumatized and fearful of the future. Over the past few days, the DRC's near-neighbours like Nigeria have taken steps to prevent the spread of the virus by introducing checks and health screening at its airports. Meanwhile, the Trump administration signaled its disinterest when it asked for Ebola-related funding cuts of $252 million as part of a package aimed at reining in government spending.